All right.
Nice to see you.
Thanks. Good to see you too. Really quick before we get started, going to do a little disclaimer. It's not working right now in the comments. So I'm just going to go ahead and get that out of the way before we get started. The information provided on this live is for educational purposes only and does not substitute for personal medical advice. We advise users to consult a local medical professional or healthcare provider if you're seeking medical advice, diagnosis, or treatment. So now that that's done, hello everybody. Thank you guys for logging on and joining us here on this live. It's our very first segment of Derm Talk. So it's really, really exciting for us. We just want to welcome everyone to being here. And what these segments are, basically once a month, we're going to be sitting down with a dermatologist from our Dermatology Board of Advisors, and we're going to talk about all things skincare and dermatology. You can ask questions either in the comments or through any of our other social media channels, and we'll be answering those questions in these segments. We're going to be getting lots of tips and tricks from the dermatologists who will be joining us on these, and debunking a bunch of myths. We know that there are hundreds of different myths out there and different opinions about what to do for your skin and what helps, you know, certain issues and whatnot. But there's a lot of wrong ones out there too. So we're going to be debunking a bunch of those. And honestly, we're just going to be gleaning all the information that we possibly can from these dermatologists. They are the professionals. They are in the business of skin. So who better to get, you know, advice and information about how to take care of our skin the best way possible than from these dermatologists. So that's what these segments are going to be about. With that being said, my name is Linda. I am so excited and so honored to be hosting this very first segment of Derm Talk. And today with us, we have our first dermatologist to help kick this whole thing off, Dr. Marisa Garshick. She practices at MDCS in New York City, and she is also a clinical assistant professor of dermatology at Cornell. So very impressive. Dr. Marisa, thank you so much for being here with us.
Thank you so much for having me. I'm so excited to be able to kick these talks off and excited for all the people joining in. And so we're looking forward to having a fun session tonight.
Yeah, awesome. I know it's going to be a lot of fun. It's going to be very informative. I'm more excited. So to kind of get started, can you just kind of tell us a little bit about yourself, kind of, you know, who you are, how you got into dermatology, what your journey has been to get here?
Yeah, absolutely. So when I was actually very young, I saw a dermatologist myself for breakouts and acne and some of the things that I now treat day to day in my practice. But being a patient going through with skin that I felt was sort of affecting my day to day, I really recognized the impact that dermatologists can have on somebody's quality of life. And so as I went through medical training and different things, I initially was drawn to dermatology based on that desire to help people in terms of boosting their quality of life. So improving the way that they felt about themselves going about their day to day. But then what I realized as I learned more about dermatology, that there is so much variety. So in a given day, you can do procedures, you can do medical dermatology, you can do things that have a quick fix and things that take some time to really figure out. You're dealing with diagnosing malignancies and cancers, but you're also able to really see a problem and quickly fix it and really help somebody kind of get back to where they need to be. So ultimately, I think the unifying theme is just helping people feel like the best version of themselves and doing whatever we need to do to be able to get there. So certainly, I think that as a dermatologist in my day-to-day practice, I see a wide variety. I see children, I see adults, I see sort of the whole generation of a family. And to me, that brings me such pleasure that I have the ability to really care from beginning to end. And so,
Yeah, absolutely. And that's a great point too. You're never too young to start taking care of yourself and your skin and to see a dermatologist. You don't have to wait until, you know, you're older.
Absolutely. And I honestly think even with us understanding even like skin cancer, we know that some skin cancers arise from some of the sun exposure that we get even as children. And so many patients come to me and are like, oh, well, when I was a teenager, I didn't know any better. And so really the education that we can impart even to the younger generation and children, and as we see where they're using sunscreen and really thinking about it in their day-to-day life really is going to hopefully make a big difference going forward.
Absolutely. Yeah, that's so important. In your practice, like you said, you see a range of ages and I'm sure different skincare concerns and things like that. What would you say are some of the most common questions that you get about how to take care of your skin, things that are important? What are some of the most common ones that you've come across?
Yeah, absolutely. I mean, I think you hit on the big one, which is really when do you start taking care of your skin? So, and really this kind of goes across all skin conditions. So for people who are dealing with dry skin or eczema, acne, rosacea, any skin condition really starts with this foundation of skincare and when to implement that. And for some people, it is in their teenage years when they're just starting out to understand what acne is all about. And they're dealing with that and understanding whether or not they need to wash their face often, or should they be using a moisturizer? Should they even be washing their face? For so many people, it's really just starting with the very basic. And so really kind of taking people along that journey. But certainly I would say the common questions that get asked are, when do you start to implement a routine? What does a routine really need to look like? How complicated does it need to be? So on the other end of the spectrum, you have people who are like, I haven't done anything for my skin in so many years. Now, where do I start? I see all these different products that are out there. And I think a lot of the times it's super overwhelming. And what I really try to emphasize both in my day-to-day practice on social media is just a lot of the times less is more. And when you're starting off in skincare, really just start off just one at a time, even if that just means sort of starting with a basic moisturizer. Certainly sunscreen is always the dermatologist's number one priority, but really focusing, and that skincare routine will build over time, and don't feel like you need to bring it on all at once. And again, I think that really goes across all skincare conditions. So whether it's acne, rosacea, eczema, you really want to have a simplified approach to begin with and then build from there.
Okay, absolutely. Now, when it comes to, we were, kind of touched on a little bit earlier, all the different myths that are out there, all the different things that you hear. What would you say are some of the most common myths that you'd like to kind of help us debunk today?
Yeah, so I mean, I think certainly certainly, I don't know where everyone's joining from, so certainly feel free to pop that in this chat. But for a lot of people, it's getting into the colder winter months, and a lot of people feel that, okay, if it's cold, if it's winter, it's not summertime anymore, I don't need sunscreen. And I think that's a big priority that as dermatologists, we try to emphasize that sunscreen is not just meant for the summertime. It's really meant for all year round. It's even meant for rainy days. It's even meant when you're inside. You want to always be mindful of it. And part of that's because we recognize that UV rays can penetrate even when the sun isn't at its strongest, and even when it's not at its peak. So you want to remember that these UV rays are what's actually going to be causing that cumulative damage to the skin over time. And so the more consistent you are and the better you are about making sure you're applying it, making it part of your routine, just like brushing your teeth, the less likely you'll experience any of the changes down the line. So really making sure you're sort of committed to that SPF 30 or higher, and really making it, like I said, a part of a routine so you don't forget, even if it is a rainy day.
Right, absolutely. Yeah, just because you're not laying out at the pool in the summertime doesn't mean that you're not being exposed, on a regular basis, like you said, even when it's cloudy out. So
yeah,
very
and
good
it's
point.
especially, I saw somebody mention something about sunspots and freckles. And again, so there's so many things, so many conditions that we end up dealing with, that the sun protection is just so essential that we often think of all these other ingredients that can be helpful for things like hyperpigmentation or conditions like melasma, but just wearing sunscreen can be the most effective.
Absolutely. And like you were saying earlier too, you have, patients come in and they have all this sun damage or, aging skin. And what they don't realize is that all of that was started when they were younger, laying in the tanning beds or not wearing sunscreen when they were younger, and it's starting to show the effects now. So yeah, it's so important to do it every day and to always stay up on that. Let's see, are there any other myths that you've heard from your patients?
Absolutely. I mean, I'm just literally going through my patient panel today. And so a lot of today actually was with oily skin and needing moisturizer. And so that's another big one, because especially as we, again, transition into colder months, it's important to remember that really all skin types benefit from moisturizer. And so when we have oily skin, it's true that you might not use the same type of moisturizer or necessarily look for the same thickness of a moisturizer as somebody who has drier skin, but it is still key to make sure that you are moisturizing the skin, making sure that you're getting that strengthening of the skin barrier, that you're supporting the hydration. And a lot of this is a misnomer because people who have oily skin often feel like they really need to dry their skin out in order to see the skin look actually better. But the reality is you just want to be able to kind of achieve that healthy balance where you're removing enough oil that's in excess, but not over stripping that skin and over drying the skin, because that's when we start to lead to essentially the imbalance, I should say, where we experience the irritation, the redness, but then people are also experiencing breakouts and they're like, what have I done to my skin? Because they're not really sure which way to go. So they find that they're a little bit confused. So oily skin, you still need moisturizer. You may not need to do it twice a day, maybe once a day is sufficient. Typically for those with oily skin, I usually recommend a lighter weight lotion as opposed to a cream or an ointment, which would be sort of more beneficial for somebody with drier skin, but definitely still using that moisturizer, even if you're oily.
Okay, so are there certain ingredients when you're looking at a moisturizer, whether it be a lotion, a cream, I know some people are very kind of confused, don't really know what the difference is between the two. Different certain ingredients that they should stay away from, or ones that would work better for oily skin, just so that they know when they are looking for a moisturizer.
Yeah, absolutely. So oftentimes gel-based moisturizers and lotions tend to be a bit better for those with oily skin. There's a greater water content, and so they absorb easily into the skin. They're not going to leave the skin feeling greasy or shiny, and even some may actually have a mattifying effect. Certain companies also may produce, you might look for ingredients that contain active ingredients. So for somebody who may be breakout prone, you might want to find a moisturizer that has a little salicylic acid in it, which we know can help to absorb excess oil, or like I said, some of these mattifying components. In terms of, on the other end of the spectrum, those with drier skin types may look for a thicker base product. So creams and ointments, which tend to have a greater content or ratio of oil to water. And so you're going to get a little bit more of that for those who are more dry and less of that in those who are oily.
Got it. That's great information. Thank you. Because yeah, we get so many questions about that, or we have people that suffer from acne, and they want to stay away from moisturizers because they think that that's the opposite thing of what they need. So thank you so much for clarifying that and helping us with that information. We did have a question come up that I wanted to ask, because I think that this is going to help a lot of people, especially when we're kind of going back to sunscreen a little bit.
Yeah.
It says, what can I do for sunspots, and what can I do to kind of fade the freckles and the dark spots that you will get either from sun exposure and age and things like that?
Yeah, so this is always a very common question, especially this time of year. Everyone's sort of been in the sun, they've accumulated that sun damage, and now they're ready to take care of it. And what's nice about this is that there's a wide range of treatment options available. So like I said, first and foremost, sunscreen, because no matter how much else you're putting on your skin, if you're not using sunscreen, then those marks are only going to get darker. So you definitely want to commit to sunscreen. For some individuals who do experience discoloration, there is some value in looking for a physical based sunscreen. Sometimes we find that can provide additional protection against certain types of sensitivity of the skin. So for certain people who may be more prone to sensitivity, we may find that they may experience more likely hyperpigmentation. So the physical blockers can reduce that. Also considering potential for blue light protection. Obviously the data is out right now, the jury is out, I should say, and more research is needed, but there is a potential for blue light to worsen hyperpigmentation in certain skin types. So some of those with darker skin types may experience that. So then kind of getting into the nitty gritty of skincare ingredients. So we know that retinols are going to be great for sunspots and freckles and just helping to overall improve the overall skin tone. Niacinamide is another key ingredient that's incorporated into lots of moisturizers and different key ingredients, the needleless serum, lots of great products that are out there that have it and can help to improve the overall skin tone. Exfoliants are great. So certain alpha hydroxy acids, so whether it's glycolic acid, lactic acid, all have do a great job at not only helping to eliminate dead skin cells, but also brightening the skin and helping to improve that discoloration. So those are generally some of the key ingredients. Other ones that we think of, kojic acid, licorice root, topical versions of something known as tranexamic acid, which can be used orally for conditions like melasma. And then really in-office procedures do a great job also with sunspots and freckles. So there's lasers that help with resurfacing. There's different lasers that actually target the pigment specifically, light-based devices. So there's really a wide range of treatments, and it's usually dependent on kind of what you've tried and where we want to go next. So always know that it's great to speak with a dermatologist because they can really help guide you in the right direction on what makes sense.
Great, thank you. A couple more questions that have come in that I'm going to go ahead and throw your way. One of them is they would like you to suggest something for pigmented neck and underarms.
So yeah, so pigmented neck and underarms I actually think is such an important conversation because for some people, this is totally normal. And in many cases, this is just a variation of normal skin. And the reason that's important to know is that we always want to set expectations when we're considering treatments for different things. And because because it is normal, it's possible it won't necessarily go away. Now, there are some conditions that can exacerbate hyperpigmentation or even cause a little thickening of the skin in the area behind the neck and in the area in the underarms. And that actually is important to actually see your dermatologist or even your primary medical doctor, because that can sometimes signal other medical conditions that may be going on related to other things, hormonal changes and things that you would want to be aware of. So another key thing of why I went into dermatology is I love that it's sort of we can play detective. So when we see changes on the outside, we can really understand what's happening on the inside. So in terms of how we think of pigmentation in those areas, so certainly if it's not related to a medical condition or secondary to an underlying problem, we can think of it as post-inflammatory. So for some people who are using an antiperspirant or deodorant that's causing irritation, sometimes that discoloration can result after that irritation goes away. And so then people are left with the discoloration, but really it's a matter of treating that initial irritation, which may be with a cortisone cream or just kind of switching up the antiperspirant. So certainly thinking of it if it's post-inflammatory and what you would want to do to treat that initial problem. Number two is sometimes using gentle exfoliants. Again, these are delicate areas of skin, so you really don't want to overdo it. But there are some exfoliating moisturizers that can be valuable in this case. Things like lactic acid, where if you use it just a few times per week, you may see some improvement in lightening of the skin in those areas as well. So I would say that's kind of where you want to go. But generally for that, I'd always say the first stop is checking in with your doctor, making sure you understand the cause. And if you find out that it's normal, understand that it is normal. Some antiperspirants do have a lightening component that they're adding to them to try to help even out the skin tone a little bit. But certainly just remember it's normal and it's okay if you have it.
Awesome. Thank you so much. Okay, another one. A question from Cole. It says, I have melasma above my lip because of menopause. It's so hard. Any recommendations?
Yeah, so melasma is definitely a frustrating condition. So I get it. I think for a lot of people either experiencing it in the summertime or related to hormonal changes, it can be very frustrating. So I totally get it. In terms of melasma, the nice thing is there are key ingredients that have been shown to be effective. So all of those ingredients that we described in terms of lightening, so things like retinols, exfoliants, chemical peels, lasers, certain lasers. And I think that's important to remember that not all lasers are created equal. And when we say laser treatments for melasma, there are some that can actually worsen melasma. So you really just want to speak to a trusted provider, make sure you know what you're getting. And then there are some prescription formulations that do include hydroquinone, combination with a retinol, as well as a low dose topical steroid. So there are some prescription options available for melasma as well as an oral medication that I mentioned called tranexamic acid, which is currently being used as well for certain cases of melasma. And then always, first and foremost, sunscreen. And so again, this is really, I think,
the most important.
yes. And honestly, I would say people even wearing masks are like, oh, well, I don't need it, especially for that melasma area on the upper lip. People are like, oh, well, my mask is covering it, I'm fine. But again, and melasma is one of those conditions that we do think of as being somewhat more sensitive to blue light and just sort of more hypersensitive to UV exposure. So really extra important on those days that it's cloudy, rainy, all of that, you do want to be extra cognizant of wearing that sunscreen. And for this, I actually happen to love physical blockers. So I really love the Dermatology physical tinted moisturizer for these patients as well, because I think it just really, it provides a nice tint, which gives you a little camouflage for those who are struggling with melasma, but also that physical blocker provides a great defense as well.
Absolutely. It's our newest sunscreen that we added to the lineup. We were really excited to get it out there. Actually, that kind of rolls in, excuse me, perfectly to our next question. From Jess, she said, what is the difference between a physical and a mineral sunscreen, and how do you know which one is best for yourself?
Yeah, so actually physical and mineral are the same. So it can be very confusing because there's lots of different terms that are thrown out: physical, mineral, chemical, inorganic, organic. But really a physical and a mineral sunscreen are designed to basically sit on the surface of the skin and deflect the UV rays. So essentially when the UV is hitting your skin, it's unable to penetrate, and the sunscreen sits as a barrier, basically blocking the rays from even coming in. Chemical filters work by actually absorbing the UV rays, converting it to heat, and that then gets emitted so that you're unable to essentially process all of that UV and have it contribute to sun damage. The main difference in terms of how we see it in clinical practice is that for some people, some of the chemical filters may cause a little bit more sensitivity of the skin or irritation of the skin. So for people who have a little bit more of a tendency to be sensitive or reactive, we may say to opt for physical blockers. But generally speaking, as far as kind of the sunscreens that are out there, it's really personal preference. So I always say the best sunscreen is the one that you'll use. So if you have one that you like and it's chemical or it's physical, just go for it. So don't get too caught up in those details. I would say the most important thing is making sure it's broad spectrum. So making sure that it's going to provide coverage for both UVA and UVB. Also that it's SPF 30 or higher. We know that there's sort of variation in how much protection you're getting based on the number of SPF that it is. SPF actually is really referring to mostly UVB protection. So it's blocking 98 or 97% of UVB rays. And that's important because when you see something labeled as broad spectrum, that's how you'll know that it's also protecting against UVA. So it's not just what the SPF says. And then you want to reapply. So I think so often people are really great at applying sunscreen, but then sunburns happen because we forget to reapply. And especially for a lot of these sun sensitive things, sunspots, freckles, melasma, even reapplying throughout the day becomes so essential, just to ensure that you're able to provide that protection long term.
Absolutely. So kind of going back to the chemical versus mineral, can we say that that's maybe another myth that we can debunk, that it's a chemical sunscreen that does not mean it's bad?
That is absolutely something that we can debunk. And I think that you don't have to feel stigmatized if you like your chemical sunscreen, and you can use it and you can enjoy it. And I think in terms of chemical sunscreen, it's just a matter of finding one, whether it's physical or chemical, that absorbs well and that you will use. So there's no value in a physical sunscreen if you don't like the feel of it. So fortunately, dermatology has covered the bases. So there's lots of great options out there.
We've got you covered when it comes to your sunscreen. We've got you covered.
Exactly. But it's true. I think it's really, I do think we've come a long way in the world of sunscreen. And I think when we think back to sort of the days of the lifeguards with the zinc paste on their nose, we can really appreciate the fact that companies have really strived to really provide a quality product for consumers to be able to apply and enjoy the application process. And I think that that's really certainly been helpful for me in terms of recommending things for my patients.
Absolutely. Yeah, we've noticed that especially with our universal tint. Oh my gosh, it's for every skin tone. Everyone can use it. It blends in seamlessly. It's just an all-around amazing product. So it's one of my favorites.
Yeah, me too.
Kind of switching gears a little bit because this question came through and I think it's a great question. I think vitamin C is a huge buzzword right now in skincare, and you find vitamin C serums everywhere and in different products, and talking about antioxidants. So this question is, why do I need a vitamin C every day? What is the buzz about antioxidants with the skin?
Yeah, so it's a great question. And what's so interesting about vitamin C is it's true. You're not necessarily seeing the day-to-day improvement. So I know even from my own personal experience, when I first introduced vitamin C, I was like, okay, so now what? And you sort of wait for that immediate effect. But what vitamin C is it's an antioxidant. And what that means is that it's protecting the skin from free radical damage that's happening. And beyond just UV, we're exposed to so many things that are causing extra sort of these free radicals to create havoc in our skin. And that can be in the context of pollution, being in a city. That is certainly something I'm not a stranger to. It can be sort of environmental stressors. It can be sort of your day-to-day kind of just going to and from work. Your skin experiences so much extra damage from these free radicals. And so what vitamin C is going to do is it's going to protect and help to neutralize that, to prevent that damage from happening. So I always say it's almost like supercharging your sunscreen to provide protection throughout the day. It's not protecting your skin the same way your sunscreen is. It's not necessarily blocking UV rays, but any damage that's happening, whether it's a result of UV rays or pollution, your vitamin C is on board to be the backup plan and to help repair that. And so what makes that so important
it's
is
a power
that
duo, what you're saying.
it is a power duo. It is definitely the synergy that you want in your skincare routine. And it's certainly one of the first things. So I know we talked about building a skincare routine. To anyone who's like starting out, that's always going to be a key place to start, because that's really where you're going to see that prevention over time. We know that free radical damage can lead to sunspots, discoloration, blemishes, fine lines, wrinkles, lead to skin laxity, loosening of the skin, loss of collagen. So all of these things, by using a vitamin C, you're going to help to protect your skin from over time. So definitely a workhorse. It's definitely one that you do want to incorporate. It's not always easy to find one, but obviously there's a great formulation. You want to always make sure that when you look for vitamin C, you're looking for one that is stable, and you want to make sure that both the stability and the efficacy are there. So the dermatology, the vitamin C, along with the vitamin E and ferulic, is what's going to help to stabilize that vitamin C and allow it to be both stable and effective over time.
Absolutely. Yeah. So you kind of mentioned how it's kind of a great starting point and it's a base for every kind of skincare. If there was one product that you would recommend kind of across the board that you would say almost everyone needs for your skin, something very important other than sunscreen, of course, what would that be?
Yeah, I mean, so of course, I think sunscreen is always the starting point. And I think I always say that the very basics are a cleanser, a moisturizer, and a sunscreen. And then if you're going beyond that, I would say a retinol and a vitamin C are kind of tied at the top. Sometimes a nice transition for somebody who may be either hesitant to start a retinol or really just kind of like, okay, I just want to start somewhere. I think a vitamin C is a great place to start, because you're going to get, like I said, this protective benefit. So even though you may not actually have a skin issue, you may not be targeting to treat, you're going to get this preventative benefit that's going to help you over time. So I always say that's definitely going to be actually an antioxidant, and incorporating that is always a good place to start.
Great. Okay, one more question that we saw in here, and this is a good one too. At what point are you over exfoliating?
Yeah, so that's huge, and I think in this era of people wanting to sort of have glowy skin and people sort of wanting that instant benefit. So kind of on the opposite end of the vitamin C spectrum is an exfoliant, which does give you that overnight benefit where you see your skin look smoother, you see it looks brighter. But that instant gratification is not always something that you want every single night. So I usually say generally limit exfoliants to just kind of 2 to 3 times per week at most for most types. Obviously it varies based on the product, and certainly read kind of the product instructions, but you know you're over exfoliating if your skin is feeling tight, if it's feeling red, if it's feeling stripped. So anything that feels like you're actually doing damage to the skin barrier, the goal of exfoliating is really to remove any extra dead skin cells that have built up. We don't necessarily want to take away the good skin cells. So it's something that you want to find that balance where we know the skin cells turn over, and as there's a buildup of dead skin, the skin can start to look dull, but you don't want to overdo that. And so I usually say if you're even just starting out in the world of exfoliating, once a week should be sufficient to start there, and then you go from there. And if you are using other active ingredients, retinols, other types of procedures that you may be doing, you may even need to do it a little bit less, or you certainly want to avoid doing it at the same time, because you want to minimize the chance of certainly over injuring the skin and the skin barrier there.
Okay, absolutely. Starting with any type of new skincare product, whether it's a new ingredient or a new product that your skin's not familiar with. A lot of people had these concerns because they will start to see their skin either get really, really dry, or their skin will start to break out, or they'll get little bumps there. And of course, that's kind of normal when you start with a new product or a new ingredient when you introduce it to your skin. So can you kind of explain the difference between the purging process? Kind of explain a little bit about what that is, or the dryness, and when is it different from your skin being irritated and it's a product that you shouldn't be using?
Yeah, absolutely. So I think that this is a very important part of sort of building a skincare routine, because you don't want to give up too soon. And sometimes you can experience these sort of bumps in the road that do cause people to say, all right, I'm done, and walk away.
Right.
But the reality is by continuing to stick with it, you actually do end up seeing further benefits. And so you want to get to that point. So generally, purging is, we usually think of in the context of certain ingredients like retinoids or exfoliating acids that are really kind of bringing things to the surface that probably would have come out eventually, but because we're sort of upregulating that skin cell turnover, we're bringing it to the surface sooner than it would have otherwise come out. And oftentimes it's coming all at once. And so for that reason, you experience, maybe it's like 4 to 6 weeks into using the product, a worsening, but that does subside. And so that's usually the sort of the biggest obstacle, and one of the hurdles that's just kind of like, just keep going, we can do it. And really try to kind of like, exactly. Because it's hard to say to somebody, oh, your skin's doing all of this, but keep using that product.
Right.
Sometimes in certain cases, we will say to scale back. So maybe not use it every night, or maybe just use it a few times per week, just to sort of balance. Obviously, we want people to go out and feel comfortable with their skin. So we don't want them feeling self-conscious about any changes. Unlike what you initially described as basically more of irritation. So when we start new products, it's normal. Our skin is sort of reacting to something new. And for some people who have particularly sensitive skin, or even just normal skin, their skin is saying, okay, this is something I'm seeing for the first time. Do I like it or do I not? And with our skin barrier, because so many of these products that we're using are designed to sort of not always nourish the skin barrier. We have plenty of things that moisturize and help, but there are also things that are sort of doing what they can to kind of take some of it away, and that can lead to redness and flaking. And so especially in the first couple of weeks of trying out a new product, start off just 2 to 3 times a week. If it is a retinol or something that's designed to be used in a small amount, exactly, and making sure, like I always say with retinols, like a small little pea size, and really sharing that between your whole face, just because you want to make sure that it's a slow and steady process to get your skin acclimated to it. So if you do experience irritation, that is the one time where I would say maybe take a pause, allow your skin barrier to recover. So irritation being redness, flaking, dryness, your skin feels sensitive no matter what you put on it. It stings, it burns. Let your skin barrier recover, because that isn't going to fix itself. So the way purging might, this really is going to sort of require a little TLC before you resume it. Doesn't mean you can't reintroduce it, but just reintroduce it slowly subsequently.
Yes, that's great. And this is another really great question too, kind of talking about retinols. Jess is asking, acids and retinols are confusing at times. For me, I went to get a facial and was told they're not necessary, and went somewhere else and they said we should always be using them. LOL, what do you recommend?
So it can be confusing, and this is really where skincare is sometimes very overwhelming. And I think what's amazing about products now is that there is a lot more transparency, and I think consumers are sort of understanding what to be looking for. But I think with that also comes, well, which one should I be using and which one is it? And so the idea behind whether or not it's necessary or not. So what a retinol is doing is it's helping to regulate skin cell turnover so that it's happening at essentially a certain rate. And when we do that, ideally, we're minimizing the chance of dead skin cells building up. So if somebody's using a retinol consistently, they may not actually have that buildup of dead skin that we spoke about as what exfoliating acids are able to eliminate. So for somebody who's using a retinol, somebody might look at your skin. So if a facialist looks at your skin, they may actually say, oh, maybe you don't actually need it because I'm not really seeing that buildup of dead skin. Now, even in those situations, because many of these exfoliating acids also deliver other benefits, they can be brightening for the skin, they can help for anti-aging concerns, for discoloration, there's still a role for them. And so it doesn't necessarily mean that they're not necessary. I think it's definitely person to person, and it is individual, and it's certainly not something that everyone should feel like they have to incorporate. But that could be why somebody maybe acknowledged this idea of maybe you don't need both. Certainly don't need both at the same time. But it should be sort of something that you take into consideration as an individual.
Right, absolutely. There were a lot of questions that came through, and I tried to get to as many of them as we possibly could. For all of those people, though, for all of you watching who did submit a question, or if you even think of something later on once we end this, if you think, oh my gosh, I totally forgot, I wish I could have asked Dr. Marisa this question, you can always let us know, and we will, or put it in the comments, and we will absolutely address all of them and answer all of your questions. So if we didn't get to it today, we will absolutely still answer them for you. Don't worry about that. But Dr. Marisa, this was so much fun, and it was so informative, and it was so great to have you here. I definitely learned something, and I know that everyone watching too definitely learned a lot today. So we appreciate you being here and giving us your wisdom and your knowledge.
Well, thank you so much for having me. It was so great seeing all the questions coming in, and certainly all great questions. And so certainly, like Linda said, if anything in follow-up, I'm always happy to help. So thank you so much for having me. It was a wonderful way to spend the night.
First segment of Derm Talk. It was so much fun. Again, thank you so much. For everyone watching, please give us all of your questions. We're going to be doing these monthly, like I said at the beginning. So we really look forward to our next one. We hope everyone will tune in, start thinking about questions for the next one as well. And we'll keep you posted of when that will be. But thank you everyone for watching. Again, Dr. Marisa, thank you so much for being here today.
Thank you. Absolutely. Thank you so much for having me.
All right. Bye guys. Thanks.